Welcome to Module 1 of our Comprehensive Tuberculosis Management course, based on the Malaysian Clinical Practice Guidelines, 4th edition. I'm your instructor for this educational series, designed specifically for healthcare professionals. In this introductory module, we'll establish the foundation for evidence-based tuberculosis management. You'll learn about the global and national burden of TB, understand Malaysia's ambitious vision for a TB-free country, and explore the key principles that guide effective tuberculosis care. This module will take approximately 5 minutes, and by the end, you'll have a solid understanding of the framework that supports all subsequent modules in this series. Let's begin by understanding the scope of the tuberculosis challenge. Globally, tuberculosis remains one of the top infectious disease killers, with approximately 10.6 million people falling ill with TB each year. Tragically, about 1.6 million people die from TB annually, making it a leading cause of death from a single infectious agent. In Malaysia, while we've made significant progress in TB control, the disease continues to pose important public health challenges. The notification rate has been declining steadily, but we still see approximately 25,000 new cases reported each year. What's particularly concerning is that TB disproportionately affects vulnerable populations, including those living with HIV, migrants, and socioeconomically disadvantaged communities. The economic burden is substantial, affecting not just healthcare systems but also families and communities, through lost productivity and catastrophic health expenditures. This data underscores why systematic, evidence-based approaches to TB management are absolutely critical.
Malaysia has set an ambitious and inspiring goal to achieve a TB-free country by 2035. This vision aligns with the World Health Organization's End TB strategy and represents our commitment to eliminating tuberculosis as a public health threat. Our strategic approach focuses on 3 key pillars. First, integrated patient-centered care and prevention, ensuring that every person with TB receives comprehensive, compassionate treatment. Second, bold policies and supportive systems that address the social determinants of TB and remove barriers to care. Third, intensified research and innovation to develop new tools and approaches for TB prevention, diagnosis, and treatment. The targets are specific and measurable: a 95% reduction in TB deaths and a 90% reduction in TB incidence compared to 2015 levels. Achieving this vision requires coordinated efforts across all levels of the healthcare system, from primary care clinics to specialized TB centers, and strong partnerships with communities and civil society organizations. Effective tuberculosis management is built on several fundamental principles that guide every aspect of care delivery. The first principle is early detection and diagnosis. We must actively find TB cases through systematic screening of high-risk populations and ensure rapid, accurate diagnosis using the most appropriate diagnostic tools available. Every day of delayed diagnosis increases transmission risk and worsens patient outcomes. The second principle is appropriate treatment with quality-assured drugs. This means selecting the right treatment regimen based on drug susceptibility patterns, ensuring uninterrupted drug supply, and monitoring treatment response carefully. Treatment must be individualized while following evidence-based protocols. Patient-centered care is our third principle. This goes beyond just providing medications. It means treating patients with dignity and respect, addressing their social and economic needs, and involving them as partners in their care decisions. We must consider the whole person, not just the disease. The fourth principle is infection prevention and control. We have a responsibility to protect healthcare workers, other patients, and communities from TB transmission through appropriate measures. Finally, we must ensure continuous quality improvement through systematic monitoring, evaluation, and feedback mechanisms that help us learn and improve our services continuously. The Malaysian Clinical Practice Guidelines on TB management represent the culmination of extensive evidence review and expert consensus. Understanding how these guidelines are structured will help you navigate and apply them effectively in your practice. The guidelines use a systematic approach to evidence evaluation. Recommendations are graded based on the strength of evidence, from high-quality randomized controlled trials to expert opinion. This grading system helps you understand the confidence level behind each recommendation and make informed decisions when evidence is limited or conflicting. The guidelines are organized logically, starting with general principles and moving through specific clinical scenarios. Each section includes clear algorithms and decision trees that guide clinical decision-making. The recommendations address not just what to do, but also how to do it, with practical implementation guidance. Importantly, these guidelines emphasize that evidence-based practice doesn't mean rigid adherence to protocols. Instead, it means integrating the best available evidence with clinical expertise and patient preferences. The guidelines provide the framework, but clinical judgment remains essential, especially when dealing with complex cases or special populations. Regular updates ensure that the guidelines remain current with evolving evidence and changing epidemiological patterns. As healthcare providers, we have a responsibility to stay informed about these updates and incorporate new evidence into our practice.
Let's summarize the key takeaways from this introductory module. We've established that tuberculosis remains a significant global and national health challenge, but one that can be addressed through systematic, evidence-based approaches. Malaysia's vision of a TB-free country by 2035 is ambitious but achievable through coordinated efforts and commitment to the key principles we've discussed: early detection, appropriate treatment, patient-centered care, infection prevention, and continuous quality improvement. The clinical practice guidelines provide us with a robust, evidence-based framework for TB management, but their effective implementation requires understanding, commitment, and clinical judgment from all healthcare providers. In the upcoming modules, we'll dive deeper into specific aspects of TB management. Module 2 will focus on smear-positive pulmonary tuberculosis, covering clinical presentation, diagnosis, and standard treatment approaches. Module 3 will address the more complex scenarios of smear-negative and extrapulmonary TB. We'll then explore special populations, latent TB infection, drug safety, and implementation strategies. Each module builds upon the foundation we've established today, so I encourage you to proceed through them sequentially for the most comprehensive learning experience. Thank you for your attention, and I look forward to continuing this educational journey with you in Module 2.